A new report finds in-person learning is essential for the overall well-being of children and youth. The Ontario COVID-19 Science Advisory Table has just issued guidelines for the safe return to in-person school this September. One parent we spoke with says her child needs to be back in the actual classroom for the sake of the entire family.
As the online learning progressed, her motivation, her attitude towards learning has really got worse. She's a very curious child. She's always been, and that was really sad to see.
Oakville mother Marge Krieger cannot wait for her 7-year-old daughter to go back to the actual classroom. It has been a tough few months for the entire family.
It's been very stressful and challenging, like for many others, I believe. It put a lot of stress on myself, my daughter, and my husband. We had to navigate around how to work from home and how to make sure she logs into online learning and she learns.
The scientific director of the Ontario Science Advisory Table, Dr. Peter Uni, says Ontario has had the longest interruption of face-to-face learning in Canada. A new detailed report finds that there is overwhelming evidence that shutting down schools and discontinuing extracurricular activities has a substantial impact on children's physical and mental health. It also has serious effects on the mental health of parents. There have been high rates of anxiety and depression observed across children of all ages.
We should stop using schools as a lever to control the pandemic.
Do you think that, the recommendations that you've made, do you think it's realistic to expect that schools in Ontario can do this by September?
A lot of what is in this document has already been extensively discussed, and a lot of that has already been addressed. If you look at the temporary measures and some of the permanent measures, such as hand hygiene, environmental cleaning, fine-tuning can happen very swiftly. The biggest ask is actually, the one that is technologically a bit more demanding. That's optimizing and maintaining ventilation.
Krieger says she's hoping the province is prepared for a smooth transition for this upcoming school year.
I think the Minister of Education ensures a proper plan of them to go back to school, proper sanitization and ventilation and class sizes. I think we will sleep much better.
The Minister of Education, Stephen Lecce's spokesperson, released this statement following the report, which reads in part, "As part of our plan and as recommended by Ontario's Science Table, all students aged 12 and over and education workers are prioritized for double vaccination prior to September, and significant investments have been made to improve air ventilation in 100% of schools. We are following the advice of sick kids and pediatric experts on our plan, with $550 million in continued air ventilation improvements underway." The report was put together by a number of experts in infectious diseases, epidemiology, indoor air quality, and other areas of expertise. Hospitals such as Sick Kids also took part. For City News, I'm Maleeha Sheikh.